Let's talk more about diagnosis through the nose, its physical changes. Changes in the physical shape of the nose are also indicative of the pathological changes in the viscera, which often can be determined by observing the outward appearance of the nose, whether there are spots on the nose and whether there is anything unusual in the secretion of mucus. The nose of a normal, healthy person is usually proportionate in size with a straight ridge and a good outward appearance, all of which indicate good health. Abnormalities occurring with the physical form of the nose usually mean that there are problems with the person's health. The changes in the behavior of the nose also reflect some internal diseases in the human body. Example, a frequent runny nose may suggest chronic rhinitis, which deserves attention. Here we have a red and swelling nostril. This is often caused by endogenous heat, mainly found in the initial onset of nasal sores, boils, furuncles, or eczema. And here we have a red nose accompanied by papules. The tip of the nose may be red, accompanied by papules, and the affected skin may become thicker after a while and turn purplish red. This is often caused by stomach heat fuming upwards to the lungs and blood clogging the lung meridian. In this diagram, we see a crooked nose. This is often associated with a foot and is often accompanied by foot pain. It is also seen in people with facial paralysis. Here we have a turbinate hypertrophy. This means hypertrophy of the inferior and middle turbinates is often caused by mucosal hyperemia or blood stasis. It is likely a symptom of the onset of diabetes or gout. Here we have nosebleeds. Nosebleeds may be caused by wind heat clogging of the lung, hyperactivity of stomach fire, liver fire flaring up and affecting the lung, or the deficiency of kidney yin. Now, tips for caring for your nose. Wash your nasal cavity with cold water to improve the blood circulation in the nose and prevent the onset of common colds and respiratory ailments. You can also massage the nose. Use your thumb and index finger to pinch the base of the nose and push and pull it up and down 12 times, which will enhance the resistance of the nasal mucosa. Alleviate redness in the nose. Your nose becomes red because there's some problem with your spleen and stomach, such as excessive heat in the spleen and the stomach. Massaging the Suzanne and nating points can relieve heat in the stomach. Massage for 5 minutes twice or 3 times a day. Nosebleed, when our nose bleeds, we assume a reclining position and the blood will collect and congeal at the front part of the nasal cavity, which is conducive to stop the bleeding. Do not tilt your head backwards, which will cause the blood to reverse back to the mouth or throat and flow into the stomach, leading to symptoms such as nausea and vomiting. Alternatively, you can massage the yin shan point, which helps clear the orifice and invigorate the meridians and stop the bleeding. Massaging this point can also relieve nosebleeds and symptoms such as stuffy nose, rhinitis, and facial paralysis. Thank you for your attention.